But if I could,
Sure.
I want to respond to the caller because he made a point that I wish I would have made. I may use that in our ad. He really made two good points. Number one, Social Security has not added a penny to the federal deficit. We have a surplus in Social Security of $2.6 trillion. It will grow by another $1 trillion over the next 12, 13 years. So why in the world are we trying to drag Social Security into this deficit debate? Social Security hasn't contributed to this problem. It in fact has helped the bottom line, the budget every year look a little better because that surplus has masked the true size of the deficit.
Who's talking about Social Security?
Oh, well, you mentioned the Simpson Bowls. There's a lot of talk here lately. You know, these meetings at the White House, I'm not there. You're not there. There are only a few people in the room. But we do get a little intelligence every once in a while, and there is a plan that we've heard that would change the COLA, the way the COLA is computed. Now, if you talk to anybody who's getting a Social Security check or about to get one, they know what the COLA is. And I kind of think we're into, remember the COLA wars? I think we're getting into another period of COLA wars because the plan is that we've heard under consideration to change the way the COLA is computed. It's called the chain CPI, so that and the COLA is based on the Consumer Price Index that measures inflation one year to the next. It's already flawed because it's measuring inflation as it impacts a wage earner, not a retiree who has different needs and buys different goods and services. And now it's already flawed. So now there's this under consideration a plan that would use a different formula that's even worse. In other words, if the price of beef goes up, you can substitute, they assume you substitute a hamburger. If the price of gasoline goes up, perhaps you use public transportation. The logic escapes.
That will be part of the COLA calculation.
Part of the COLA calculation. If the price of public transportation goes up, what do you tell a senior? Well, now you can walk. I mean, the whole idea of this change CPI and substitution, I think, is seriously flawed. But there's a lot of money to be saved there.
How much?
Oh, billions and billions, because the COLA is the increase. By the way, there was no increase last year, no increase the year before. And if this new formula is used, seniors are going to say, well, how are you going to reduce my COLA below zero? Do you want my money back? Do you want some of my benefit check from the last year turned back? So there's a lot of money to be saved.
Which side is putting forth this COLA change?
You know, as I say, I'm not in that room. There are very few people in that room.
But you're getting intelligence.
Absolutely.
Who's putting it forward? The administration?
I don't know if the administration is. I don't know. But I know members of Congress are very interested still in Social Security. And as I said at the outset, Social Security should be completely off the table. Whatever reforms, and Social Security is a dynamic program. It's changed over time, changed dramatically in the early 80s. That is an entirely separate discussion. Can I say one other thing about the COLA? Because it resonates so dramatically with our membership, and I'm sure seniors in general. We need not a formula, a chain CPI, a formula for determining what inflation does to a senior's purchasing power. We need a more accurate COLA, there is an experimental Consumer Price Index Elderly, it's called. It's been around since the late 80s. It looks at, in determining what a COLA should be. It's never been applied. It would be larger, slightly larger. But it looks at those goods and services that seniors rely on and places an accurate weight on that market basket of goods and services. And yes, you asked how much money is involved. Don't forget the COLA is built into the base, if there is a COLA, and that's compounded. So over time, it makes a difference, but it makes even more of a difference to the individual senior trying to get by in life.
All right, we'll go to Frank, a Republican in New York. Thanks for waiting, Frank.
How you doing? This is Frank from New York. I'm glad to take my call. I have a problem. When I was 65 in 2008, I did 3 months before, followed the rules. I enrolled in Social Security A and B. I mean, not in Social Security, in Medicare A and B. And I chose to pay it quarterly instead of out of my Social Security check because I wish to wait till 70, which I have the right to, in which I can get more money from Social Security. Well, in January 10, they raised me from $96.40 to $110.40. Then in January 11th, they raised me to $115.40. Then I went to my congressperson's office, and we had a three-way conversation with Medicare and me and the congresswoman's representative. And the question was, why is Frank paying more? It isn't because he didn't do it on time. It isn't that he has a large income. It's because they said that the politicians set it up that because you are not getting a Social Security check and it's coming out of not coming out of your Social Security check, but you're on time and paying it quarterly, you go up. Now, I know, in fact, that in this country, that would be against the law, against any medical plan, that if they want to charge you two different people the same, two different prices for the same coverage, that they would not be allowed to do this. It's identical coverage, but I'm paying more. So instead of paying it out of my left pocket, I'm paying it out of my right pocket. That was the answer. They said, well, Social Security told us we can't raise the Social Security people who are getting checks. But you, we can.
All right, Max Richtman.
I have never heard of this situation, but I don't know. It sounds like you have taken some steps. You had a three-way conversation with your congressperson and the Medicare officials, but I would be happy if you want to write this down. Our toll-free number is 1-800. It's easy to remember. It's 966-1935, the year Social Security became law. 1-800-966-1935. If you call, you can ask for me, Max Richtman, and we have some terrific caseworkers who have been able to help individuals. I don't think you're a member of our organization, but we'd be glad to help you out.
Gary Duncan tweets in, does your guest acknowledge majority of funds expended by Medicare and Medicaid are at end of life? How do you propose to address this?
Well, I'm not going to get into a death panel debate this morning. It is true that a large expenditure of these Medicare and Medicaid funds probably do involve end-of-life care. I'm not in a position to say that those funds shouldn't be expended, but I do think that there are in the Affordable Care Act, there are provisions, not death panels, but ways to coordinate care so that savings, whatever stage someone is in the process of life, to have savings by coordinating care in much more than is done these days. So I guess that's my answer.
Senior